question. Right. So if you have read and understood, considering a surgical anatomy patient, kindly tell me, what are you looking at in picture A and B? What, if you can explain it to me, please?
Yes, it is a popliteal fossa of right leg.
Okay. Can you tell me? How would you describe popliteal fossa? What is it?
Okay. So in popliteal fossa, it will be the behind of knee joint, and
Okay.
there will be some muscles. Each will involve the boundaries, and there are some important structure within it.
Can you tell me the boundaries of the popliteal fossa?
Yes. In laterally, upper laterally, biceps femoris, and lower it will be the lower head of gastrocnemius. Medially upper there will be semimembranosus, semitendinosus, and lower medial there will be medial head of gastrocnemius. And the floor will be the popliteal surface of the femur, popliteus muscle, and some ligaments of the knee joint. And the roof will be the superficial and deep fascia.
All right. Can you tell me the contents of the popliteal fossa from superficial to deep?
Yes, from lateral to medial, there will be common peroneal nerve, tibial nerve, popliteal vein, and artery, and some other some other contents. There may be lymph node, small saphenous vein, posterior cutaneous nerve of thigh, and genicular branch of obturator nerve.
Okay. A patient comes to you with a bulge or a mass on the back of his knee. You look at the mass, and what are the differential diagnoses that you'll consider?
There may be
Yeah.
popliteal vein varicosities, Baker's
Okay.
cyst,
Okay.
schwannoma, lipoma.
Yeah.
There may be a popliteal artery aneurysm, lymph node enlargement.
Good. How would you confirm your diagnosis?
To confirm my diagnosis, first of all I want to confirm my diagnosis, I want to do an X-ray
Okay.
of knee joint,
Yes. And
then MRI,
right.
CT
And the
MRI.
most importantly, the clinical examination.
Yes, the clinical examination.
Yes. Okay. Can you please help me and identify what is number 1 over here in picture?
Yes, ma'am. This is the biceps femoris.
Okay. If you can identify number 2 over here.
Common peroneal nerve.
Very good. And if you can identify 15.
The 15 is tibial nerve.
Very good. If you can please identify 11.
11 is semimembranosus.
Very good. If you can identify 4, please.
Medial head of gastrocnemius.
All right, very good. Moving here on picture B, if you can identify 16, please.
16 is tibial nerve.
Okay. If you can identify 10.
10, yes, this is the vein, popliteal vein.
Popliteal vein, very good. And if you can identify number 8 over here.
This is the deepest popliteal artery.
Very good. If you can identify 7. Where is 7?
11. 11 is
No,
semi-membranosus.
7.
7. Kothay 7? Ma'am, where is 7? Could you please?
Yes, on myself looking that. Yes, I can't find. Okay, forget it. Can you tell me how the knee joint is formed?
Knee joint is formed by um, lower head of femur
Yes,
and upper head of tibia,
yes.
and
In between, yes.
in between there is
What stabilizes the knee joint?
knee ligaments, some ligaments.
Yes, you have to name the ligament. Yes. And
The
what is
cruciate
the
ligament.
and
Um,
can you tell
can I
me
come back to this?
yes, what are the flexors of the knee joint?
Flexor of knee joint.
Yes.
That is rectus femoris.
Are you sure? Flexor. What flexes?
No, ma'am. No. The flexor of the knee joint are the hamstring muscles.
And which ones are the hamstring muscles?
The hamstring muscles are biceps femoris, semimembranosus, semitendinosus,
Yes.
and
Now you're
adductor
telling me.
part of the yes,
Okay.
adductor part of the
If we are coming back to biceps femoris, can you tell me where does it insert?
biceps femoris has two head.
Very
Now
good.
they insert the long head in the fibular head and the short head in the tibial condyle.
Okay. And function you already told me. What is their nerve supply?
The long head by the tibial nerve and the short head by the common peroneal nerve.
Okay. And what is the nerve supply of semitendinosus and semimembranosus?
Tibial nerve.
Good. Okay. Tibial nerve is a branch of which nerve?
Tibial branch are the branch of the sciatic nerve.
Okay. If you can tell me what stabilizes the knee joint? Or you said you'll come back to that later. Okay.
Yes, ma'am.
Can you tell me what are the movements which are possible at the knee joint?
Flexion and extension.
Is that all? Okay. Can you tell me what type of joint is a knee joint?
Knee joint is a hinge.
Hinge type of. Okay, good.
Hinge.
Can you also tell me, please? What was the question? Okay, if you can tell me, how would you test the knee reflex on a patient?
Okay, to check the knee reflex, I will ask the patient to hang their leg,
Yes.
and then I will support it by from the behind, and I
Okay.
will tap on the muscle just below the knee joint.
Okay.
Then it will extend. Then I will if I put hammer on the muscle, then the
Yes.
knee will extend.
Okay. And that will confirm, or you'll be checking which root value with the knee reflex?
L3. L3.
Okay, knee L3, L4.
L3, L4.
Right.
Okay.
So if you can tell me the dermatome and myotome of the whole lower limb or the skin around the knee.
Skin around the knee is L3.
Okay. And
Then lateral L5. Lateral
yes.
and dorsum of the foot L5.
Yeah. And what about where would you check for S1?
S1 is the lateral malleolus.
Left hand. Good. Thank you. Perfect.